My presentation is on Remeron. That is the brand name. The generic is mirtazapine. It is used mainly as an antidepressant. The way it works is not just fully understood. It is thought to be to affect communication between the nerve cells in the central nervous system and to restore chemical balance in the brain. It is used to treat major depression, though it does have other uses. Okay, I'm not going to go into the other uses, but this is a medication that the psychiatrist that I work with prescribes on a pretty general basis to most of my clients that have major depression or bipolar or schizophrenic or schizoaffective. Okay, you should not take Remeron if you are taking tryptophan. Do not use it if you have an MAO inhibitor in the last 14 days. Most people, especially young people, might think about suicide when first taking an antidepressant. You have to be in very close contact with your psychiatrist or your doctor. See them on a regular basis while you are using Remeron. Also, you should have your family or your caregivers be alert to any sudden changes in your moods or any other symptoms. You need to report any new or worsening symptoms to your doctor, such as mood or behavior changes, anxiety, any panic attacks you might have, any trouble sleeping, if you feel impulsive or irritable, agitated, hostile, aggressive, if you're restless or hyperactive, either mentally or physically, if you feel more depressed, or if you have any thoughts of suicide or hurting yourself, or maybe hurting others. Do not give this medication to anyone younger than 18 years of age without the advice of a doctor. Remeron is not approved for use in children. It should take several weeks before your symptoms improve. You need to keep using the medication as directed and tell your doctor if your symptoms do not improve after 4 weeks of treatment, more or less. Drinking alcohol can certainly increase certain side effects of Remeron, so it is not recommended that you drink alcohol when taking this or any other prescribed medication. Remeron may impair your thinking or reaction. Be careful if you drive or if you do anything that requires you to be alert. And before taking this medication, you should not take it if you're allergic to mirtazapine or if you are also taking the tryptophan. And again, if you are taking an MAO inhibitor in the last 14 days, don't take the Remeron. Okay, you also need to tell your doctor if you have liver or kidney disease, if you have glaucoma, if you have bipolar disorder, manic depressive, if you have any type of seizures or epilepsy, if you have low blood pressure or dizzy spells, any high cholesterol or high triglycerides, if you have had any history of heart disease, including angina, a history of a heart attack or stroke, a history of drug abuse or suicide thoughts. Okay, it is not known whether Remeron will harm an unborn baby, so tell your doctor if you are pregnant or plan to become pregnant when using this medication. It is not known whether it passes through into breast milk or if it could harm a nursing baby. Again, tell the doctor if you are nursing a baby. You need to follow all the instructions on the prescription label. Do not take this medication in larger or smaller amounts than it is prescribed or for longer than recommended. Remeron is usually taken only once a day at bedtime, but follow your doctor's instructions. Take the Remeron with water. Okay, there's also a Remeron Sol Tab, which is an orally disintegrating tablet. That one you keep in the tablet. You keep the tablet in the blister pack until you're ready to take it. Open the packet and peel back the foil. Do not push the tablet through the foil, or you could damage the tablet. Use dry hands to remove the tablet and place it in your mouth. Do not swallow the tablet whole. It needs to be allowed to be dissolved in your mouth without chewing it. You might want to think about drinking liquids to help dissolve the tablet and to help swallow it. Okay, do not stop using Remeron suddenly, or if you have any unpleasant withdrawal symptoms, ask your doctor how to safely stop using it. You need to store it at room temperature away from moisture, heat, and light. This medicine is used to treat mood disorders, thought disorders, or mental illness. Migraine headache medicine, you need to tell the doctor if you're taking anything like that, or any seizure medicine. Other drugs can interact with the Remeron, including prescription and over-the-counter medications, vitamins, or herbal tablets. So be sure you tell all your doctors, including your healthcare providers or natural food store providers, that you're taking this medication, especially your psychiatrist or the prescribing doctor. Common side effects of Remeron include severe sedation, constipation, drowsiness, weight gain, fatigue, insomnia, and increased appetite or decreased appetite. Other side effects could be dizziness, increased serum triglycerides, tremors, hot flashes, palpitations, vertigo, abnormal dreams. I found through my clients that abnormal dreams, especially very vivid nightmares, happen quite frequently under this medication. Even if it's sleeping at night or sleeping during the day. Also, the taste of your mouth becomes bitter. Decreased libido is also a side effect. Okay, you might experience dry mouth or constipation or nausea. You might have abdominal pain, acute vomiting or diarrhea. Your abdomen might become enlarged. You have nausea, vomiting, gum hemorrhage, colitis. These are rare side effects. Okay, more than likely you will experience weight gain. Sometimes it's uncommon for people to have weight loss. Also, less rare is, or more rare is gout. It might bring on the onset of diabetes. And again, psychiatric, abnormal dreams, thinking abnormally or confusion, apathy, depression, agitation, anxiety, and insomnia. More rare is delirium, delusions, depersonalization, increased libido, hallucinations, manic reaction, mania, neurosis, hostility, emotional lability, euphoria, paranoid reaction, and vivid dreams. Okay, psychomotor restlessness, drug withdrawal symptoms, and paranoia.